Hi there, here we are with our patient Mark. And Mark is back here after about 3 years. He did his surgery back in, I think July 2021 or something like that. I went out to the hallway at the waiting room and I saw him and I'm like, he looks great. And we were talking and he was very happy and stuff. And then I went back and I looked at your photos and I'm like, holy crap, this is life-changing work. I forgot how bad it was in those terms. It's incredible. He was pretty much a class 6. He had some little hair up there, but we just did the one procedure. We did the Max Harvest Plus where we were able to move as much as possible for him. I haven't seen him since the procedure for follow-up in person, and it's just life-changing results. I mean, unbelievable. But tell me what you think about it. What do you think of the process?
Yeah, I've gotten comments from family members, friends about the difference before and after. It took about a year for the final results to come in, but I'm very happy, and that's why I'm back again for more.
That's awesome. Now, I do remember talking to you originally because you had lots of concerns about my method versus going to do the FUE, and you really drilled me on that.
Yeah.
Do you now understand?
Yeah, I researched different doctors, different procedure types for years, and then ultimately I finally made a choice and was very happy with the choice.
So he was a very, very detailed researcher and had lots of very lots of questions about the different procedures and really questioning me on my method versus the other methods, and I was able to convince him why I do it the way I do, which is I want to move as much as possible. I want to limit the amount of the small grafts, which the FUE is, and concentrate on moving as many of my larger grafts, which I call them multiple follicular unit grafts, and that creates the density. So my one procedure that got him this result, and just tuck your head down just a little bit, he was totally bald. I mean, you'll see the pictures in a second. He was totally bald. He was bald. He was bald. I mean, this guy was a bald. You'll see in a second. So I took him from this, from bald to that in a procedure, and I tried to explain to him, just half their head trying to get that fixed with the FUE will take 3 surgeries. The other half of your head with an FUE will take minimum 3 surgeries. And he's coming out like this after 1. Now, to me, he's still not done. It looks awesome. It's life-changing, but today we're going to go through tightening up the areas where he had the smaller grafts, going between the larger grafts, which are the multiple follicular grafts, and kind of close things off. But if he chose not to have another procedure, you could live with this and be happy. But this is what happens with my patients. They get this result, they love it, and then they want more. And so he's back. So I love it.
Yeah.
So now tell me, has it changed your confidence? Has it changed how you're interacting with people?
Yeah, I used to wear hats all the time before my procedure. I was very self-conscious about my head. I also didn't want it to get sunburned.
Okay.
Because I was worried about things like skin cancer too. I'd go to the beach and my head would get burned on top. But now since my hair has grown back after the procedure, I actually prefer to not wear hats.
That's awesome, man.
And I feel very confident because it is full. So there's no reason to cover it up.
Now I'm going to get comments in the video, and people are going to say, well, he's wearing his hair curly and he's doing this. So is this your style? I mean, is that how your hair grows?
Yeah, this morning I literally just washed it. I didn't do anything else to it. I didn't dry it all the way. This is just
your natural hair.
Yeah.
This is natural hair.
Yeah, we didn't style it or anything before the video. I'm just sitting here.
Okay, so I'm going to kind of show you off now. So basically, there was no hair here in the front. So we went through here. This is all now brand new hair. You can just look at this. It's all brand new hair all the way through. All this brand new hairline all the way across. So we reframe the face all the way to one side. Let's spin you around here for a second. Reframe this all the way through. All these tiny little grafts make this nice and soft and natural all the way around. People are always like, comb through the hair. This is me combing through the hair. So you don't see the big grafts don't jump out at you. Nothing catches the eye. This is all his natural hair, just like that. I'm gonna spin you around here. We went into the crown. I built a spiral. This is all now none of this existed. So this is all transplants. I'm gonna go through today and fill this in. You have to understand, he was totally bald. And now we went from one procedure from 0 to 60 in, whatever, the amount it took to grow. When we do the hair transplant, we do these big cases. I'm harvesting all the way up here on the sides, okay? He shaves this short. He's tapering this down short. My suture line is way up here, okay? I take it high on purpose so these patients can taper beneath here and still have that nice style. But this is what the suture line looks like. It's this tiny little line. You can see it nicely here because he shaves, you see that little tiny trace line? And then this kind of runs around, okay? This line, you don't ever see. He can cut this short like he's doing. You'll never see this hairline. So these guys are chasing around the world, flying off to Turkey, getting these cheap hair transplants, thinking they're getting this great deal, but then they get hacked. I just had a guy here last week having me fix his hair transplant from Turkey. They destroyed the donor versus this tiny little line. I mean, you're talking this little trace line is what people are flying across the world trying to get a better result. They can't get the bigger grafts that I use with the FUE, and they can't get the amount of hair that I move with the FUE. Look at this. That's it. That's what everyone's freaking out about, is this tiny little line, which that you can still taper your hair and you'll never ever see that line. No one's going to see that line. Has anybody ever saw your hair transplant line?
No.
Has anyone ever said anything to you about it?
No, I've even had it shaved all the way down to 0 before, and even then it was
No one says anything.
barely visible.
And this is what you were focused on, remember originally?
Yeah.
You were so concerned about this line.
Yeah.
And I said, trust me, when people come in freaked out about the line, I say you don't understand what to look for in a hair transplant. What you want is a result. What you want is naturalness. What you want is limited surgeries. This line is undetectable. You grow the hair, it covers it. In the worst case scenario, God forbid there's an issue, I fix it for free. I'll graft it, I'll cut it out, I'll read it. Fixing a hair transplant suture line is the simplest things in hair transplants if there's an issue. So all I do is pull out a little line and put it together. Then it closed under no tension. When I'm doing these big cases, I'm taking huge pieces out, and then it still closes like that. So if there's ever an issue, it's super simple to fix. And there's never issues with that stuff. So I'm using you as my example because I do in particular because you were beating me up on that FUE, I remember, right? Sorry. Are you taking Propecia?
Yeah.
Okay, you doing Rogaine?
Yep.
So he's doing his part. He's doing the preventative treatments. He's keeping what he has. He's one of the greatest results that I put up there with my work over the last 27 years as far as transformations goes. So I'm super happy for you. Tell me what you say to the guy who's sitting at home, who's on the fence, who's thinking about doing this, that's apprehensive, wants to fly to Turkey. What do you say to that guy?
I probably did more research than you. I was researching this for 5 to 7 years. I was waiting for new techniques to come out. I was reading, journals of dermatology and all types of scientific things, not just marketing. And then I spoke to Dr. Bolton. I could tell it wasn't a sales pitch. It was just about real work, real results. And I'm very happy because I have seen people who have gone to other doctors using different techniques and not had, results that are even close. So
it captures everything. After doing this as long as I have, he was very particular about his studies and his research, and he knew what he wanted as far as he thought, and it took a lot of convincing. Right? Took a lot of convincing because the marketing out there the other way is they make it convincing as well. But anyways, I think if you're looking for someone who's done research and then to have this result, it speaks volumes, and I'm so happy for you, and I'm excited to do your next surgery, and I appreciate you doing the video for us.
Thank you.
You're welcome, buddy.